recently about possible causes of autism. Well, let's continue the discussion now and talk about what parents can do with a young person that has autism that maybe in the past they were unaware of was available to them. Dr. Ann Donnellan is here this morning, the director of Autism Institute at USD. You've got a group of parents and educators and everything meeting here in San Diego right now to discuss better, more effective ways to deal with autism patients?
Yes, I think they're better and more effective, but at the minimum, it's a way of looking at the world from the child's perspective. I think the research is very clear, and certainly the people with autism tell us that they're having problems with sensory and movement.
Well, let's make it real clear for people again exactly what we do know about autism and what it is. The thumbnail sketch of what autism is.
Autism is a pervasive developmental disorder that starts in early childhood or at birth and continues throughout life. Now, lots of things can mediate that, but certainly we don't have any cures.
And it kind of takes the form quite often of kids who don't communicate. They might start communicating, and then for whatever reason they stop and they regress.
That seems to be real clear for some kids. And other kids, it appears that they've been the way they are from birth.
And it just, at this point, like you say, we don't have any cure for it. But the ways of dealing with it are really starting to change, and people are gaining some new insights here. What's this about movement and what you can tell from movement?
Well, movement is not just motor, but movement of emotion, movement of speech, movement of everything requires a great deal of organization in your body. And I think it's useful to think of these kids as having bodies that are very poorly organized. So while some of the behavioral things work because they make things clearer for kids and they help the kids know what they should be learning, taking a sensory movement approach as well gives us a better sense of how we can make the kids more comfortable, how we can help them understand what's happening in their bodies, because it's a little bit like Parkinson's in older people. They sometimes get stuck, they can't move, and they don't know what to do, and we don't understand it because we don't think about it that way, so we think they're being just disobedient or unwilling to help, and stubborn and so forth, when in fact they have a great deal of trouble organize their bodies to do things that typical kids do.
So this is a much better understanding about the entire process of what's going on with autism.
Absolutely.
From top to bottom.
Well, we think so, and the fact that we're putting the emphasis on what we know from people with autism as well as the research about what the experience is.
Now, ironically, you're finding that as you solve some of these problems, you're getting information from autism patients themselves about what they're experiencing. Specifically, you're helping them communicate now what's going on inside of their bodies and inside of their heads. You're finding ways to communicate that are just amazing. Just give us a couple of those.
Well, first of all, lots of people with autism communicate with speech and don't need a lot of remediation about that. But a great many, at least half, don't have speech. And so we're using a variety of augmentative systems, whether they're picture boards or words or letters. Letters, of course, are the most helpful because it's like chemistry. You put the letters together, you can do just about anything. And sometimes it takes physical support, and particularly in the beginning to get the kids going. But at our conference, we had a young woman who was considered to have an IQ of 29 when she was 13 years old, before she had a way to communicate. And now she's a junior at Whittier College. And she was nominated for an Academy Award 2 years ago for a documentary about her life that she wrote. Now, not everybody's going to do that, just like the rest of our kids.
But it certainly gives incredible hope to parents who have kids with autism that are just wondering, what's the future hold here? It may be brighter than we think.
So, absolutely. All right. Brighter than we think.
Dr. Donnellan, thank you so much for the update. Good to have you here. And please come back and see us often.
I certainly will.
All right.
Thanks so much.